This is part two of an interview with Dr. Jeff Ross, former editor-in-chief of the AJNR, discussing his approach to reviewing an article as part of the AJNR's Academy of Reviewers project. I'll now take you back to where he left off.
All right, so let's we'll just go through the abstract and go through the different parts. I know, again, Dr. Castillo covered these, so I'll just skim through these. But this is a very important aspect. It may be the only part that most people will ever read of the paper if they're not reading the whole body. So it needs to be able to stand alone, should be well articulated, match the style that the journal wants. Please read for the author section to know the particular style. Also, please, as an author, please go back and make sure that the abstract actually matches what's in the paper, because sometimes you're doing your revisions of a paper, you do the body of it, you're covering all that, and then it's the last thing you do. Oh, yeah, I got to go back and change the abstract. And sometimes that doesn't get done. So make sure everything matches. The intro, why you need to hit the reader with like why you're doing this in the first place. Why are you bothering me with the time that I had take to read this? Why is this important? Should have a not complete, but a brief review of the literature as to why, again, underlying why this is important. What's the rationale? Are there goals? Introduce unusual terms. Please be careful and always check abbreviations. From the author side, please be careful with like these papers where they're in, you can't read them because there are so many abbreviations. I find that very difficult. If you can all expand those and get away, I know the word count, I get that, but staying away from abbreviations is helpful for trying just to read the paper. Materials and methods. This is the user manual or the recipe of the study. This is critically important because you want enough information to allow someone else to repeat the study. It also gives a good sense to the reviewer and the editor of, just the diligence that's being going into this study, and should have some outline of the statistical methods. The results should follow from the materials and methods, and ideally is going to parallel that presentation of the methods, and use section headings. Those are very helpful also from the author side. And then the discussion. If there was a hypothesis, hopefully there was, but not all papers have a hypothesis. It was that verified or proven untrue, or if there was none, what were the questions that were answered? Do the results, what happens to the other stuff that's out in the literature? Do the results match? And, from the reviewer side, you're looking at all of that. Does the discussion stay focused, and is it relevant to the current literature? You always have to note the limitations of the studies, because that's just what everybody does. But again, I would say, I know Dr. Castillo again touched on this, I would agree with that. Please don't say you need more subjects, because that line is always used, and every study needs more subjects. So that's really kind of doesn't add anything to the paper, in my opinion. And then that concluding paragraph. Figures and graphs should illustrate the features. They should be really essential to understanding. Doesn't need to be filler. Watch for HIPAA issues, of course. We want high quality, again, read. They should be reading the journal instructions. It needs to be available for the reviewers in a form that they can actually see the image and make a judgment of the quality. And then the legends that explain the meaning, and the legend should match the figure. Please, again, as a reviewer, that's important. Does the legend tie actually to the figure, and is it the correct figure? So that's what you're doing on a reviewer side, and that absolutely happens. And you even see stuff that's out in print that, the legend, obviously nobody read it and it doesn't match the figure. So those are always embarrassing. We'd like to be able to catch those. Tables are for complex data interactions, just to make it more understandable. And particularly good, I think, if there are comparisons that need to be made with different columns across, so the reader can look at columns. So that's important, and that's the reviewer's job to actually look at the table. And if there are numbers, do the numbers add up? Do they match the body of the report? That's that nuts and bolts aspect of looking at them. From the author's side, um, you know, stay away from tables. They make it a little bit more complicated. If it can be put into the materials and methods as prose, like MR sequences. You can give a series of MR sequences. MR sequences don't always have to be a table. It doesn't necessarily add to the paper. And again, references timely and accurate. Please, please, please follow the journal citation format. And the reviewer should check that and make a note of that. Do they support the claims? And again, this is an area that the reviewers can be very, very powerful in the sense of actually looking at the references. Are they appropriate to the paper where the author is saying that they're being cited? Does the reference actually say what the authors are alleging? That's a high bar. It's work, absolutely, but it's an important one. If there are a few key references that they're hinging the whole argument of the paper on, it really behooves the reviewer to go back and look at that primary reference to see if it is germane to what they're talking about. And again, please, did I mention, follow the journal format? So why do they get accepted and why do they get rejected? A lot of variability here. So hopefully it got accepted because, and as you're considering a reviewer, why would you accept it? It's timely, it's relevant to a problem. In other words, it's going to fill that literature gap. Maybe it's a novel technique or problem. It's importantly well-designed, appropriate methodology, and then the underlying just readability and comprehension of the manuscript is always very important. Well written, logical, and easy to comprehend, not lost in just the data. Rejected, there's a whole slew of reasons for rejection, a not insignificant one that we see it just doesn't fit the scope of the journal. That should never, not say never, but should rarely make it to a reviewer. Those should be editorial rejects on the side of the journal coming in. On my side, as an editor, so comes in. And there are this is some kind of editor-in-chief level, like what is the scope of the journal? So we do get in AJNR, we get a fair smattering of musculoskeletal stuff. And I'm never quite certain, but if it's kind of distal to the elbow, less likely that a neuroradiologist is going, although it's kind of musculoskeletal and somehow ties into spine, not really. So there is some confusion on people's parts when they know what the scope of the journal is. It doesn't add to the literature. Again, separate, I think, from reproducibility. It's nice to have that in, our literature has a dearth of reproducibility data because it's, again, has a higher bar of getting accepted. It's, and you come back with, well, this has already been done. Why should we publish it again? That's a tension that always exists. I don't have a great answer for that one, but overinterpretation of the results is a common one that you've just gone too far. In the author's mind, they've got a thesis, and they are going to cram the data into that thesis, and they've overextended. That is not uncommon. Sample population may be too small or too biased. Not the statistics are poor. And finally, in the end, what's the grammar? It may not be a final rejection, but there may be a rejection. Just here's this paper again, have it run through one of the services for translation, clean up the English, and then come back to us. There's a lot of variability there. So that's my quick spiel on the review process. And again, to reviewers or hopeful reviewers, thank you very much for giving of your time and your diligence and your expertise.
Thanks for that, Dr. Ross. What incredible advice. This is a nice addition to the Academy of Reviewers project with the AJNR, and is a nice addition to what Dr. Castillo has added on this topic. A couple quick questions for you while I've got you here. One is that, and I was just having a discussion with this with a colleague the other day. So, sometimes performing a review can feel like a monumental task, and there's a
Yes.
lot to it, and maybe it is supposed to feel that way. And certainly as a younger faculty, it can be pretty daunting. And you often, even though you might be an expert or have some expertise in the topic that's given to you, you might not feel like you understand all of the literature, and it can feel daunting. So question number one is, how long do you typically take to do a review? That would be first.
It depends a lot on the paper. So anywhere from an hour to several hours.
Okay.
But if you're into more than like 4 hours, then that's, step back and think about it, because again, other life goes on and things have to happen. But if it's 5 minutes, that's probably too short. If it's 6 hours, that's probably too long. Um, there is, I mean, with the caveat, there's always, I mean, that's why I always love to review, because I mean, I always learn so much from it, because then again, you get lost, at least I did, down rabbit holes of like, look at the literature, figure this out, or I didn't know that, and then you add to your knowledge base. So there is that component, but it's kind of separating out that component, I would say several hours. The and there are kind of bad aspects to the tail ends. Don't want to be too quick, don't want to be ridiculously long.
That's great to hear, and it's good to hear kind of what the benchmark is for kind of what you're aiming
Yeah,
for with forming a
yeah.
good review. So in those few hours that you spend kind of reviewing this article, do you have any advice on how to tackle some of these things? And so one would be, how do you perform an assessment of the current literature? Are there any tricks up your sleeve that you have for doing that, or really assessing, where does this literature fit in the existing, where does this paper fit in the existing
Right.
literature?
Yeah, so actually, Google Scholar is still a really good tool, and for quick and dirty, Scholar set the time limit, the last 5 years, and so you don't get flooded with data. And I think that's a good point to start. And if you have a really good electronic library available, then you can tie back and forth, because Google Scholar by itself doesn't give you links to the native data on everything. So I tend to use that combo of, well, here's the name of the paper that seems interesting. If I can't get it, then I go to, in my case, the Mayo Library, which pretty much has everything, and then I can find that paper and pull it back and look at it. I think those kind of search engine aspects are pretty good. You can also go into Web of Science. That's another good source to look at current literature, and you can look by date and last few years and see what's happening. Yeah.
Okay, no, that's great advice, and I like that you said you look kind of in the past 5 years, just kind of rather than seeing the entire existing literature that's ever been there, you kind of limit that to a finite amount of time.
Right. I mean, you're again this aspect of relevance, and if it is the history of something, obviously you got to go way back. But for the most part, you can try to minimize as much as possible that data set that you're looking at. Yeah.
Okay. And one other question, just in listening to what you said, one thing that can be challenging as a reviewer, but sounds like very, very helpful for the editor, is to kind of perform some degree of fact checking on the references and making sure that the references line up well with what's being said. It's not uncommon to get an article with 40 or more
Yeah.
references, and
Yeah.
that's a lot of references to go through
Right.
and kind of validate. So one thing, I believe you've already said this, but that stood out to me is maybe you don't have to fact check every single reference, but maybe focus in on the references that are the primary supporters of the main point of the article. Is that correct? Is that kind of
I,
how
I
you
I think
approach
that's well
references?
summarized. That's
Okay.
exactly right. And you see this in the flow of the paper, that there's a critical few references that the whole hypothesis and reason for existence, and then you have ancillary references. So those few, I think that's a critical aspect to, I think, the review, to go back and fact check that. And I've really appreciated the time that that's been pointed out by reviewers specifically, that, well, we looked at this, and what they're saying actually doesn't match at all, like what they're saying, and it's like, oh, okay, and then you go and double check. But so that's, I think, a very important aspect. Yes.
Awesome. That is all the questions I have, and really
Very
appreciate
good.
walking through the presentation. This will be a nice reference for me. It's funny, I was doing a review earlier, or about a week ago, and I was thinking about how do I want to structure my review, what sections, how do I
Yeah.
want to do it, and we'll
Yeah.
definitely refer back to your PowerPoint to help me with that in the future. So
Well,
thank
thank you.
you.
Yeah, it's been a pleasure. Thanks for the opportunity. I really appreciate it. Thank you.